Hello everyone. Today I am going to speak about health education. Very important concept in public health and preventive dentistry. When we talk about health, many people think it simply means being free from disease. However, health is much more than that. Health is a dynamic and holistic concept. It includes not only physical well being but also mental and social well being. In our day to day professional practice, especially in community dentistry, we realize that treating disease alone is not enough. Preventing disease and promoting healthy lifestyles are equally important. Health education plays an important role in empowering individuals and communities. They help people gain knowledge, develop positive attitudes, and adopt healthy behaviors that improve their quality of life. So, today I'll briefly discuss the definition of health, concepts of health education, and most importantly, the principles of health education that make our efforts effective and impactful. Moving to the definition, according to the World Health Organization in 1948, health is a state of complete physical, mental, and social well being and not merely the absence of disease or infirmity. This definition highlights three important dimensions: physical well being, mental well being, and social well being. Health education. Health education can be defined as a process that informs, motivates, and helps people adopt and maintain healthy practices and lifestyles. It is not just giving information, it is a planned learning experience aimed bringing about desirable behavioral changes. Moving to the principles of health education, we have the principles. For health education to be successful, certain key principles must be followed. They are credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, good human relations, feedback, community leaders, setting an example. Let's see one by one. Credibility. Information provided must be scientifically accurate and evidence based. The educator must be knowledgeable and confident. When people trust the sources of information, they are more likely to accept and implement the advice. Without credibility, even the best message will fail. Next principle of health education is interest. The topic must be relevant to the audience. If we are educating school children, we must relate oral hygiene to issues they understand, like tooth pain, bad breath, or appearance. Using stories, demonstrations, and real life examples helps create interest. When interest increases, learning becomes effective. Participation. Health education should not be a one way lecture. It must involve active participation, asking questions, group discussions, demonstrations, and interactive activities. When people participate, they understand better and remember longer. Motivation. Knowledge alone does not change behavior. People must be motivated. We must highlight the benefits of healthy practices and reduce fear or misconceptions. For example, explaining how regular brushing prevents costly dental treatment can motivate better oral hygiene practices. The next principle of health education is comprehension. The message must be easily understood. We should avoid technical jargon and use simple language appropriate to the audience educational level. Visual aids, charts, and demonstrations improve comprehension. If people do not understand the message, they cannot follow it. Reinforcement. Repetition strengthens learning. Health education should not be a one time activity. Follow up sessions, reminders, posters, and campaigns reinforce key messages. Reinforcement ensures long term behavior change. Learning by doing. Practical experience enhances understanding. As the proverb says, if I hear, I forget. If I see, I remember. If I do, I understand. For example, demonstrating the correct brushing technique and allowing the children to practice improves retention. The next principle is good human relations. A health educator must be kind, respectful, and empathetic. Building trust and rapport with the community is essential. When the people feel respected and comfortable, they are more willing to listen and cooperate. The next principle is feedback. Feedback helps evaluate whether the message was understood correctly. By asking questions and encouraging responses, we can identify misunderstandings and improve our teaching methods. Feedback makes communication two-way and effective. Community leaders, the next principle. Community leaders act as bridges between health professionals and public, involving village heads, teachers, or local influencers improve acceptance and participation in health programs. They help us understand cultural and social factors that influence behavior. The next principle is setting an example. A health educator must practice what they preach. If we advise oral hygiene, we must maintain good oral hygiene ourselves. Role modeling has a powerful impact on communities. People learn not only by listening but also by observing. To conclude, health is a holistic and dynamic concept that goes beyond the mere absence of disease. It includes physical well being, mental stability, and social harmony. A truly healthy individual is not only free from illness but is also able to function productively, maintain positive relationships, and adapt to life's challenges. Health education plays a central role in achieving this holistic health. It is not simply about providing information or delivering lectures, it is carefully planned process aimed at bringing about voluntary and sustained behavioral change. Through health education, individuals gain knowledge, develop positive attitudes, build essential skills, and most importantly, become empowered to make informed decisions about their own health. For health education to be truly effective, it must follow essential principles such as credibility, interest, participation, motivation, comprehension, reinforcement, community involvement, feedback, and role modeling. Each of these principles ensures that the message is not only delivered but also understood, accepted, and practiced. When people trust the educator, actively participate, feel motivated, and receive continuous reinforcement, behavioral change becomes sustainable. Involving community leaders and setting good example further strengthens the impact of health education programs. Community response Communities respond better when they see consistency between what is taught and what is practiced. As a healthcare professionals, especially in the field of public health dentistry, our role extends far beyond diagnosing and treating diseases. We are educators, motivators, and advocates for healthier lifestyles. Every counseling session, every school program, every community outreach activity is an opportunity to prevent disease before it occurs. By promoting healthy habits such as proper oral hygiene, balanced nutrition, and regular health checkups, we reduce the burden of disease and improve overall quality of life. Ultimately, Prevention is always more effective, economical, and humane than cure. When we invest in health education today, we build a healthier and stronger community for tomorrow. Thank you. Thank you for listening.